Hello, everyone. My name's Charlie. I'm one of the neurology leads on the Optimize interview course, and I wanted to give you my top tips for doing well in the CV station of a neurology interview. My first tip would be choose a very clear structure. This sounds very obvious, but it's very frustrating when a very good candidate with an excellent CV is having to think their way through their CV as they're telling it to you, and sometimes getting distracted or looping back, inserting something in slightly the wrong place. So choose a clear structure you're comfortable with. A lot of people use the sort of CAMP, clinical, academic, management, personal structure, which I think works really well, and stick to it. That just helps the interviewer focus on what you're saying rather than thinking, where are they going to go next? I always start with my name and the current job I'm doing, and then I go into whatever structure I'm going to use. But it just gives them something to build off, and I think it sort of gives you the best chance to really shine. The second tip I give everyone is to remember that you are applying for a job here that you think you should be able to do. You're not applying for a job that's aspirational, that's well beyond reach, and you don't really need to talk anymore like an SHO. You need to talk like a registrar. And by that, I mean you need to say that you took jobs on and that you got something out of them. And you need to drop language that implies you were lucky to do jobs or you were fortunate, you're at the right place at the right time. And I know it's very easy to say that. We all have imposter syndrome sometimes, but you have to sort of change your language slightly to be, I did a neurology job and this is what I got out of it. Or I've done a lot of stroke cover and this means I'm very comfortable doing this. And I think that that's the sort of language they want to see. And it also just means that you come across like you're ready to go when you start in February or you start in August, and you're not going to be overwhelmed by it all. And my third point, which is obvious again, is timing. Be really clear that you are not going to be given any more than 2 minutes to present your CV. They will have a timer. They will stop you if you go on too long. They may let you expand on things afterwards and follow up questions. Oh, I think we cut you off a bit there. What else would you have told us about? But you have to be ready to go, like clockwork, 2 minutes, learn it like a script. Anticipate they'll ask you questions afterwards, but don't, think you can just go on and on because they will cut you off halfway through your academic achievements and you won't get to tell them that you were the senior registrar or the lead SHO or anything about that. You won't get them to tell them the nice sort of anecdotal personal story you wanted to go in with. So 2 minutes is your absolute target and practice, practice, practice to get there. All right, I hope that helps and I'll see you on the course.